We hear a lot about the big, flashy breakthroughs in patient care, but there's a quiet revolution happening in the back office of healthcare, and it's all about financial health. It's powered by something called FHIR. So today, we're going to pull back the curtain and show you how this tech isn't just another IT buzzword, it's a massive game changer for your revenue cycle. So let's just start with a really basic question. In an age where everything is instant, why does healthcare finance feel like it's stuck in the past? Well, it really boils down to this thing called financial friction. It's this tangled web of disconnected systems and manual mistakes that just silently drains money from practices every single day. All right, let's dive right into that idea of financial friction. See, behind every single patient visit, there's this incredibly complex flow of data. And when that data is all chopped up and disconnected, it creates these huge and often hidden costs. There's a really great analogy for this problem. Trying to share healthcare data the old way is exactly like trying to plug an ancient DVD player into a brand new smart TV. I mean, sure, you might eventually get it to work with a whole mess of clunky adapters, but it's going to be slow, it's going to be expensive, and it's absolutely going to glitch out on you. And this slide just lays it all out, right? It's the core problem. On the left, that's the old way, data silos. That means people manually typing things in, which leads to errors, expensive one-off fixes, and just frustrating delays. But the new way, over on the right, that's what true data exchange looks like. Automated, accurate, flexible, and happening in real time. So how do we get there? How do we bridge that gap? Well, that brings us to the solution, which basically acts like a universal translator for all this disconnected data. Let's talk about FHIR. Okay, first things first, what on earth does FHIR stand for? It's Fast Healthcare Interoperability Resources. Now, don't let that super technical name throw you off. The concept is actually really simple. It's just a modern rulebook, a standard, designed to let all these different healthcare systems share information with each other easily and electronically. This quote just nails it. Think of FHIR as a universal translator and a super efficient postal service all rolled into one. It makes sure everyone is speaking the same language, and then it delivers exactly the right piece of information to the right place at exactly the right time. So what's the magic behind it? Well, it's actually pretty smart. It's built on the same modern web standards that power all the apps you use every day. It uses these standardized resources, which you can think of like Lego blocks of data. A block for a patient's name, one for an appointment, another for an insurance claim. Because everyone's using the same blocks, different systems can finally speak the same language. It's that simple. Okay, now let's get to the good stuff. Let's connect all this tech talk directly to your bottom line, because this is where it translates into real dollars and cents. We're going to look at 3 specific ways FHIR can seriously supercharge your revenue. All right, benefit number 1, and this is a huge one, faster, cleaner claims. Claim denials are one of the biggest headaches in the whole revenue cycle. A denial means delays, it means more work, and it's a direct hit to your cash flow. FHIR attacks this whole problem right at the source. So just picture this for a second. A patient checks in for their appointment. In the background, before they even sit down in the waiting room, a FHIR system is instantly talking to the insurance company, verifying their coverage in real time. If there's a problem, a typo in the name, an expired policy, it gets flagged immediately. You can fix it right there, on the spot, not weeks later when a denial comes back. It's that simple. Benefit number 2, supercharging the absolute nightmare that is provider credentialing. I mean, anyone who's dealt with this knows it can be an unbelievably slow, paper-heavy mess. Getting a new doctor approved to bill insurance can take months, and every single day of that delay is lost revenue. And look at the difference here. It is night and day. On the left, that's the old world. Mountains of paperwork, endless manual data entry. But on the right, with FHIR, you get a single, centralized place for provider data, where updates can happen automatically. What's the result? The time it takes gets slashed, and your providers can start bringing in revenue for the practice way, way sooner. And for our third big benefit, we're talking about something really strategic, getting smarter with your payer contracting. When you sit down to negotiate rates with insurance companies, you need data. But way too often, practices are forced to rely on old, stale reports from months ago. This chart says it all, doesn't it? When you're negotiating based on guesswork and old data, your position is weak. But when FHIR gives you real-time performance metrics, you know, what your reimbursement rates and denial patterns look like right now, you walk into that negotiation with a powerful data-driven strategy. You can actually get better terms because you can prove your case with fresh, up-to-the-minute facts. And really, those three things are just the beginning. This brings us to the bigger picture here. The future is all about being fluent in your data. When your information can flow freely and easily, the advantages just ripple out across your entire financial operation. I mean, just look at what else this unlocks. With real-time data, you can give patients accurate estimates of what they'll owe. You can speed up prior authorizations. When a denial does happen, you have all the data for an appeal right at your fingertips. And maybe most importantly, you can finally get real analytics to make smarter financial decisions across the entire organization. And it's so important to get this. This isn't just some nice-to-have tech idea. This is the direction the entire industry is being pushed. This shift is happening because of both technology and major government regulations, like the 21st Century Cures Act, which basically mandates this kind of data sharing.
So, what does this all boil down to? It means you have to start viewing this as your strategic advantage. In today's healthcare world, being fluent with your data, it's just not a luxury anymore. It's an absolute necessity if you want to survive and grow.
So when you put it all together, what's the real payoff? You streamline your billing, you speed up credentialing, and you optimize your contracts. And as you can see, these pillars all come together to build a smarter, faster, and just fundamentally stronger financial foundation for your practice.
Look, the bottom line is simple. The ability to exchange information seamlessly in real time is no longer just a cool feature. It is a core requirement for any healthcare organization that wants to not just survive, but actually thrive.
Which leaves us with one final, and I think critical question for you to think about. I want you to look at your own systems, your own workflows, and ask yourself, honestly, right now, is your data working for you or is it working against you? Because the answer to that question could very well define the financial future of your entire practice.